Welcome to the next episode of the Many Minds podcast, where our goal is to encourage collaborative community healthcare using many minds for better outcomes. We want to understand what makes your specialty special and how we can support you to provide better care for your patients. I'm Alex Davis, physician assistant, along with Tyler Murray, nurse practitioner.
General disclaimer, this podcast represents the opinions of myself, Alex, and any guests that we have on the show. The content from this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. We're just here to learn from each other and have a good time.
All right, Tyler, primary goal today. This one's a bit unique.
Yeah.
Don't get us fired today.
Oh, you know what? I'm glad you said that. I haven't thought about that.
Yeah.
Now I'm really scared.
Yeah. Tyler, who do we got with us today?
Today, we are honored to have Dr. Edwards on the podcast. We're going to be talking about Summit and kind of the APP role, and kind of, Dr. Edwards, your vision of how you see this play out in your mind, and then kind of what it's really manifested in reality. So with that, Dr. Edwards, I think we should just open it up. Tell us a little bit about your background and then kind of Summit and its development.
I went to medical school in Iowa and residency in Indiana and neurosurgery residency. My residency training was awesome. I think some people consider residency as a tough time, and it was hard, but boy, it was really a special time. And then I grew up in Utah Valley, and I actually went to Provo High School, which was announced as the location of the BYU's new medical school yesterday.
I saw that, yeah.
And I just thought, man, that just came full circle. I can't wait to hopefully go in there maybe and participate a little bit with the new medical school.
And the campus is going to be the Provo
High School campus.
Yeah.
My high school is now going to be
a new med school.
New medical school, which like never happens.
Yeah.
It was crazy.
Yeah.
And so I've been in practice in neurosurgery for 10 years in this community. And Utah Valley Hospital, which is the hospital I do and have always done the most cases, is right next to Provo High, the old Provo High School, which is why they're putting the medical school there in part because it's the proximity to what is a really good hospital. And so every morning when I walk in, I can see BYU, where I went to college, the house I grew up in actually on the side of the mountain, and Provo High School from the hospital. And it kind of just gives you a perspective on the journey every day. It kind of reminds you of where you came from and how you got here a little bit. And I like that. So anyway,
awesome.
that's me in terms of here I am now, 10 years into practice.
I love
Still
it.
trying to figure it out, I think.
Of course. Yeah. And then a little bit of background too, because we got talking about this has been a project in the making for a little while, but now using the avenue through the company of Summit of now doing this podcast. Mm-hmm. How did we get to this point? How do we get to the point where we've got all these resources available and people in place?
Yeah. So Summit, we started Summit about, 5.5 years ago. And initially it was like a disaster. We talked about it.
Real
like
talk,
like
right
the
here.
dark
Real talk.
ages. Like it was,
Yeah.
we didn't know what we were doing. And
might I interject? I was a fish out of water. I was a brand new provider.
we hired Tyler,
which
and
probably was a mistake. For you guys, I walked in, I was oblivious to all the stuff that was happening in the background. And so for me, it was exciting. It was new. And I didn't realize, fast forward now looking back, I'm like, man, that must have been a very stressful time.
was stressful.
Because you started this from the ground up.
And Shay and I worked together a lot in the operating room, and you came on and really just got thrown into clinic every day. And I said, Tyler, let's talk every night. We'll review the cases together. And it was in that context that I recognized the value of that learning process. You're the one seeing the patients. You're getting the history and physical. You're formulating your own ideas. And then you're discussing it with someone. That's how you learn best, because it pushes you to actually think if you're in an environment where you're just with whoever is perceived to be the expert and they're always telling you the answers, you never have that, I've got to make a clinical impression here. And so I think that process has led you to become really expert in the diagnostic algorithm and the workup of a patient, and has led to all of our advanced practitioners becoming expert in that, which is one of the real strengths in the practice.
And I admitted on our interview, when you interviewed me with your dad, that I, as a bedside nurse, did not look at a ton of imaging.
Yeah.
Like, I was not very versed in dissecting an image and being able to pick things out. And I remember very vividly just looking over your shoulder, going into the clinic's visits and just looking over your shoulder and watching you and how you would scroll through the image. And all I was doing is just try to take mental notes of exactly how that was. And then again, what you alluded to is that conversation afterwards, like at the end of clinic, we'd review cases and you'd be able to give me feedback, and then I could go back and look at it again. And that repetition, I think, is what really helped me grow as an individual. But you almost have to be, what you said, thrown into the fire for you to like truly learn it. So I appreciated that.
No matter what station you are in medicine, whether you're a brand new medical student, PA student, nurse practitioner student, nursing student, EMT, anything, the opportunity to see a patient, to get a history, to do a physical exam, to look at any imaging available, and to start to think about what's going on is one of the greatest ways that you can learn. And then having somebody nearby to talk to about it can be just a very effective learning process. And so I think that that's been a great thing.
What's the situation now? You can give people some insight into how the practice functions with utilizing the advanced practitioners, and how does our dynamic work in the office?
Yeah. So one of the principles that we decided was important is that everybody ought to be practicing at the level of their license. Medicine needs this. There are not enough of any type of provider within the field of medicine. There's not enough physicians, there's not enough advanced practitioners, there's not enough nurses. And so we need to have everyone operating at the level of their license and giving opportunities to more and more to join the ranks. So now we have the group of you, and on our team there's 4 who see all the patients in the clinic. And it could be, I think every patient's a VIP patient, right? And we treat them all the same. My own dad has come to clinic and he saw one of you guys, not even me. And so we treat him the same. And so somebody might think, well, gosh, why am I not seeing the doctor? And I would say, because you don't want to see the doctor. Why wouldn't you want to see the doctor? Well, you do want to see the doctor, but what I mean by that is you've got an advanced practitioner that has more time, honestly is probably more empathetic, if we're being very honest, is probably a better listener, and has no incentive other than to take good care of you. I try to think that my incentive for making good surgical decision making has nothing to do with finances, but I mean, it is how a surgeon makes their money. And so you get to formulate an opinion. You've spent time with the patient, you've listened to their story, additional workup can be done. The timing to get into clinic is much shorter than if you always had to wait for the surgeon. So all of these things are better. And then you send me your impression and I can look at it from home. And there's evidence in spine and in cranial surgery that the decision-making, this happened with COVID, the decision-making is just as good via telemedicine as it is in person, because so much of it's dependent on what the symptoms are and what the imaging looks like. And so then I can formulate my own opinion. And really, you're getting two opinions with a unified objective in helping you get better. And I like that. The other thing that's really nice that I think might not be understood by a patient going through this process is I sometimes will look at an image and look at a history and be a little bit unsure what the right answer is. I don't have to make a decision right then and there. Whereas if you were in clinic, there's a pressure. You've got your next patient in 5 minutes. You've got to do something. And I think that for me, sometimes my clinical decision making is better when I'm in a relaxed environment with no time constraint. And if I need an extra day to think about it, or if I've got to call a colleague and ask a question, or just kind of stew on it, or read something else, or look up the literature, I have all of those things available to me. And so I look at every case, I look at the images, and then I'll message back, hey, Alex, hey, Tyler, this is what I'm thinking, and this is what I think we ought to do. And then we go forward with the plan.
Yeah. I think there's a unique thing that's happening, and you just alluded to it, behind the curtains of how much work is actually put in with the team, right? So we're seeing the patient, we send you a message. You're usually in surgery. One of us is assisting you. But then at the end of your day, you're coming home and reviewing those messages and going through the scans. So I think it takes a team buy-in for that process to truly work. And I think, you figured it out. My question is, did you always know in the back of your mind you'd have 4 APPs supporting you or helping you?
No. That evolved and has become a good model for us. But that was never something that I thought about. I never imagined I would be as busy as I am. I don't think I want to be as busy as I am sometimes. but yeah, no, never did we think that we would have 4 advanced practitioners whose schedules are completely full all the time.
That's crazy. And it takes one of us to get about 25% of what you do.
No,
that's true.
I am amazed about your level of just dedication and energy. You've got energy for days, my friend.
One of the visions for the practice is, I think our core essence as a practice is agility. And it has a dual meaning, right? Our ability to help patients move and our ability to respond to their individual needs. And as time has gone on, I've recognized that what we really want as a future vision and as our current vision is to provide that care with agile teams of people, groups of people that function well together, that because it takes a team to provide good clinical care.
Yeah, efficiency is a big deal. I don't feel like anybody in medicine is helpful if you're not available, or if you don't have the bandwidth to provide the service needed for them. So yeah, I've been impressed. I think we've fine-tuned it quite well to be agile and efficient and available, and to really be able to use our license to the full capacity and be helpful for the community. How about on the flip side of that? I think people are always interested. What have you done, or what are your strategies to make sure that you can maintain that high level of efficiency and high productivity? Is there a balance to life? Is there things a strategy that you've found to be real successful to help you maintain that level of efficiency?
I think, I'm not sure that I'm answering your question right, and it's something that's always on my mind. My kids just played in the state tennis tournament last week, which I was really grateful to be able to go to. My oldest is graduating from high school tomorrow. We have a 10-month-old and a 19-year-old, 5 kids. And I think that in all of this, staying connected to your family and committed to them is the best longevity play. And I hope everybody within the practice can be there for their family. And if there's something important, they can be there, and they can be there because it's a team effort, not an individual effort. I think another really important one is we talk to patients about taking care of their health and their bodies. And I think that providers need to do the same thing. We should be exercising regularly. We should be eating healthy, getting into good habits, good routines, not neglecting our own selves because we're trying to care for people, which is actually pretty easy to do.
Mm-hmm.
And so, but the best thing is just, we have to be healthy to take care of somebody. I really love the concept of flow. So in that book, Boys in a Boat, when the rowers were in harmony and unified, they could row at a highly productive rate without as much energy output because it was efficient. And so working in a flow state, even in a busy clinical practice, be in the moment, be unified, not rush. We never rush surgeries. We do a ton of surgeries, but we never rush a surgery. We always do it to completion, the best work we can. We don't rush appointments. Again, all these messages come through. It's not about just getting through the messages. It's more about looking at each one individually. And if I think the flow state is a really important way to stay efficient, but be able to do it for a long time.
Yeah.
I'd say one strength that I've noticed just being in the clinic, in the practice, is our ability to connect as a team. And I think much of that is attributed to your willingness to let us go out and do things together as a team, to build our kind of relationship outside of clinic. And it's been fun. I think about some of the memories of the trips we've taken.
Yeah.
I mean, things you just wouldn't even be able to make up happen. So it's been fun. And your vision, I think from the early on was let's do things together.
I will never forget. You know where I'm going with this.
Yes, I do.
We're in
set you up for this
California adventure. It's late at night. We were there for a national meeting, of course. But we had to go to Disneyland. And I don't even know, the ride was open. There's no line. It was one of the last rides we did that day. And we were in neighboring cars. And
this is the Cars ride.
The Cars ride.
Yeah.
And I was in not Tyler Murray's car, unfortunately.
Oh, man.
And they must look at the pictures of the teams riding in those cars, and whoever has
there's
the
no
highest
steering wheel.
enthusiasm is going to be the winner or something.
Yeah.
But there's this reserved, very quiet Tyler, and then there's the Tyler on the Cars ride.
My inner kid coming out.
That was so fun.
Memorable.
So
and I
fun.
remember that because I don't know if it was the same day, but that trip, there was a time where we had gone all day going on rides together. It was like the adult Disney trip. It was awesome. Fun. And then Alex and I were sharing a hotel room, and I was tanked, and I was like, I just want to go sit in the hot tub. So we had a plan to go up and just, because we knew you guys were going to keep going. And lo and behold, I don't remember how it happened, but we were in the lobby.
We all meet up in the hotel lobby, and our mindset is we might just tap out and be done for the night. And somebody else brings up the idea, let's get back out there. And then sure enough, Tyler and I find ourselves back on the ride somehow.
And had we not,
had a blast.
The best part of the whole thing.
There's a picture of me. I think it was just like a few of us, but at the end it was like midnight. We were eating ice cream,
sitting on the curb eating some Mickey Mouse ice cream. Yeah.
Just memorable times, and I think that's what's allowed us to re-energize, and be able to continue to do what we do.
And we've done a lot of fun things, but another memory from that particular trip is we missed our flight.
Oh my!
And I've never had more fun missing a flight. I don't think anybody in the history of the world has had more fun missing a flight. It was like, it's just another day at the office. Something didn't go right. And that's how medicine is. It doesn't always go right. And the question is, how are you going to respond? So it was stupid that we missed our flight. We're not going to get into that.
Yeah.
Different story, another day.
But we were like, well, Salt Lake Airport probably has some flights. So we got in the car, the 5 of us, right?
Yes.
The rest of the group made their flight. So they went to the beach for half a day.
Yeah.
And we drove by the time we got to the airport, which is 45 minutes away, we had new flights. Thanks to, I think Alex and Lindsay got the flights.
Yep.
We sat down, had a nice breakfast.
Yeah.
And we had planned to go to the national meeting that day, but we had missed that. So we went to the beach and just had this memorable
in our business
afternoon,
attire, mind you, in our business
figuring
attire.
out how to change at
Pulling
the
our
public
luggage in the
bathroom.
Yeah.
And then throwing a football around that somebody secured somehow and jumping in the water. And then we had a great dinner. And
memorable.
Yeah.
I mean, I think that just sort of captures the idea that when you work with a team and something doesn't go right, something is amiss, you can handle it so much better. And then the joy associated with being in a team is just that much greater.
Mm-hmm.
So those two experiences on back-to-back days sort of highlighted those two things.
And we've had several others.
There's been lots of others.
Yeah, we probably don't have the time to get into those, but
I have one more though.
let's hear
So
it.
I've made a few wrong turns in my life, but the greatest wrong turn ever was on the houseboat.
Oh my goodness.
We were going back from the beach at Lake Powell, and these two were the captains of the boat, which is great because I did not want to
And
drive.
between the two of us, how much experience did we have driving a houseboat?
Goose egg.
Zero
Goose
between
egg.
the two of us.
So we may or may not have a cut piece of rope
Yeah.
in the clinic.
We maybe
as a
left some of the
memoir
anchor
for-
behind, but
But we were driving back. It was a great trip. It was our retreat last year. And we were pulling Scott Perry's boat with a couple of the teenagers in the boat. And lo and behold, they had been waving at us for an hour. We didn't know because we were having so much fun talking on the top of the houseboat. We had made a wrong turn.
yes.
So the houseboat trip took an extra hour and a half to get back. And it was the best wrong turn ever because we just enjoyed
It was so much fun.
sitting on the top of the houseboat talking and being together. And that was pretty special.
Amazing food. Shout out to Amelia.
Yes.
If you ever need somebody to build out a food plan for a trip, Amelia's your gal.
Scott's replicating that trip, by the way,
Yeah.
this summer
When you
with the
told me
same
that-
meal plan.
I was like, that's
That's funny.
hard to replicate, but worth a shot for sure.
Yeah.
Yeah. I love that.
So a lot of good memories. I think it's really important that teams of medical providers work together as a team. They're unified. The processes are efficient. Everybody's operating at the level of their license, and that you also make time for fun. Sometimes to have good memories, do some things that are different, learn together. We work pretty hard. We've had a lot of late nights, a lot of difficult situations to work through. So it's okay to take a breather and do something fun as well.
I love that. I love that.
All I know, well, until now, I've got an insider's view now, but up until recently, what I knew about residency as a physician and the specialty of neurosurgery came from the show Grey's Anatomy.
Yeah, very realistic.
And it's very realistic. That's exactly how it is.
Which came out my very first year of medical school.
Did it really?
That was a hit. Everybody watched it in medical school. That's when I
Including
knew.
you?
We watched the first season. I think that was it.
That was it. That was enough.
And you were hooked. You were in.
I was like,
Neurosurgery's the path.
I was thinking neurosurgery, and then I realized maybe not. But anyway,
Anyway,
Where are you going with that?
I'll try and remember. But it's chaotic and it's crazy and there's tears and there's 80-hour weeks and things like that. But give us a realistic view, I guess, into what the life of neurosurgery is like now.
It's busy. I mean, it is overwhelmingly busy. So I'm up every morning. I try to do a little bit of workout in the morning. I usually look at messages morning and evening because sometimes I don't get through them all. And I sort of just say, I'm going to look at everything and check everything morning and evening. And usually I'm in the operating room, try to get there a few minutes before the surgery, talk to the patient, then go round if there's patients in the hospital. And then we're basically in the operating room doing cases all day, almost every single day. And there's an advanced practitioner, as you know, with me each day. And then between cases, I'm usually responding to messages, and I get texted several times every single day. Can you see this person? Can you see that person? What about this? And so I'm trying to stay on top of that. Talk to the family that we just operated on their loved one, and then talk to the next family and get ready for the next surgery. And then try to get home on time. I get home, I check in with Marie, obviously check in with Ella, check in with the boys. We like to have family dinner. We go for a walk almost every night. I shoot baskets almost every night. That's one of my favorite things. And if it wasn't for Marie, I probably would just stay out there all night. And then I'll check messages again in the evening, a little bit of email. I have an administrative role in the practice as well. So I'm talking with Jen, our chief operating officer, and Amelia every day. Usually try to call them in between cases and then respond to the emails in the evening. And then kind of quiet down. I like to read a little bit at night and then back at it the next day. And it's like that every single day, just about. So it's crazy.
One thing I wanted to say to the APPs listening that I've learned I've been in practice for 5.5 years. And the one thing I've learned as of late is that surgeons do like to hear about the patients that are doing well. I feel like as APPs, sometimes we're hounding you about situations that are complex or that we need some assistance with. Mm-hmm. And so I've tried to make a conscious effort when a patient's doing really well.
Yeah.
To send you a text. I think even one time I FaceTime you with a patient.
Man, I thought I was in trouble.
Oh man, I didn't think about that at the time.
No, I really did. I was like, this is. He's like, do you have a second? I'm like, yeah.
Can I FaceTime?
And then can I FaceTime you? And I knew it. I was like, this is serious. This is gonna be some horrible complication you just noticed in clinic.
Turned out to be not that. Yeah. Patient was doing great and actually just wanted to say thank you and give an update. And it's rewarding because I think as a team, we all want to feel that. And not every time are you able to experience that just because of our setup and how we do things.
Yeah, and I appreciate that. I think that there's been times in my career when I've felt more burnt out than others. Right after Ella was born, going back to work and having the more sleepless nights with the newborn and things was pretty tough. And then actually the last couple of months have been really hard. And Dr. Gustin starts in August, which I think will be a big relief. Far and away the hardest thing in medicine is complications. They're gut-wrenching. They just take the wind out of your sails. They really just, they're awful. And it feels like you're dealing with complications all the time because that's what either it's the new patients coming through or it's a complication. And so a new problem or a problem that is related to trying to help somebody. And so I think back to this idea of working as a team, anybody, but especially the advanced practitioners, can really lift the burden for each other and for the doctors that they work with, because it's real. I mean, it is. Medicine is not friendly right now to physicians, and for multiple reasons, it's become really, really hard to practice. And so we love it. We want to help people, but it's not an easy thing. Yeah. And so having guys like you there, and Lindsay and Brandy and many others has been the only reason that I would be able to even do it.
Love that. I think about that when you could have 1,000 good reviews and have one bad review.
And that's what you would think.
And
that's what you would think.
You would be stuck on that and could let it define you. And you just gotta be able to have perspective of the whole. And it's just nice to work as a team, because I've so oftentimes come to you guys and you guys have picked me up when I was like, crap, I messed up, or this didn't go perfect.
And you've
could have done better.
You've sent me positive messages. I love that. And then recently, one of our really, really tough, long, drawn out complications, we recognized we needed to go back in again. And it was going to be a several hour revision, and there was no time to do it because I was going to be off the following week. So the only time was Saturday. I hate operating on the weekends. And I also recognize that it's a burden on the OR because they don't have as many people there. They're trying to just do emergencies. This needed to be done. It was an emergency. And then it's a burden on you guys. So I had no expectation that anybody would be there, but Alex was there. And it did take several hours, and it was really good that he was there. And we had to put in a cage, which I've really never done before this big, from C2 to T1. And I mean, it barely fit through the skin incision. And I was so discouraged the whole time. And we put that cage in and expanded it in one pass, and the x-ray looked perfect. And I just had this sense of relief. Anyway, and it was in part because you, Alex in this case, but you guys collectively as a team, you're there. And it's just really quite amazing.
Yeah, I love that.
Well, that's great. That's probably a good way to wrap it up. This is my favorite part of the whole thing.
Oh my gosh.
I gotta deflect and pass it over here. What'd you learn today, Tyler?
Well, I think I'm going to spin this a little bit. I don't think it's so much what I learned because we have the insider's view. My hope is that the advanced practitioners listening or others listening just gain a perspective of how a practice can be run. Obviously, there's several different ways you can run a practice, but this is one unique way. And for me as an advanced practitioner, I truly appreciate the team collaborative effort. I feel like we're not perfect and we're still refining and making changes, but I think we recognize that. But in all of that, we have fun. And I think you're our fearless leader. I have to comment. There was a picture that was sent in. I used ChatGPT
and put it on
because I've talked to Dr. Edwards about this. We are building a new building. I don't know if I can say that, but I'm saying it. And I've always told him we should have his face like on a big banner, like LeBron James or Kobe Bryant.
Yeah,
just a big banner, just hanging down of Dr. Edwards. I just feel like it would be perfect. Now he's very much opposed to this,
but AI can do it.
And so I took this picture and I did an AI. I got some feedback, but it was fun doing it, and it was super quick. I just put it in. And anyway, I digress.
A little.
No, but I just hope the listeners appreciate kind of the unique situation we have. And obviously, if there's questions, we're happy to answer them. But hopefully just take this in stride that, you know, as you kind of go into practice, you start thinking about how things can be ran. And of course, having a fearless leader that has the vision is a good starting point. So,
perfect. Anything else you want to add to it?
I think you guys do great work, and I think it's cool that we need more advanced practitioners in medicine, PAs, nurse practitioners, willing to come in, join the ranks, help us out, become every bit as smart or smarter, every bit as capable or more capable than any of the doctors. And there's so many people to help. So it's great that you're doing the podcast to help teach and instruct and inform.
Brandy's doing her part. She's convincing all the pre-med students.
And she's right. If they're pre-med,
medical school is not.
You've got two.
You're out.
You should just be a PA. Yeah. And I can't argue with her. I think if I had to go back and do it, maybe I should have been
all right.
a PA.
There it is. You heard it from the neurosurgeon himself.
There you go. Well, I get to kind of speak collectively because we're all part of the same group. But if anybody's interested in following up or has comments or questions, they can find us on the social medias. We've got Instagram, which is Summit Brain, Spine, and Orthopedics. Our YouTube channel is the Summit Medical Institute. And then, as always, come see us in person Tuesday morning, 7 a.m. at the Mountain Point Hospital in Lehigh, Utah for our in-person case discussions, which Dr. Edwards presented at this morning. For our listeners out there as well, we want to hear some reviews and feedback on the podcast. What do you like? What don't you like? What would you like to see in the future? Special shout out to our production team as always, Dallin and Amelia, making things happen behind the scenes. Special shout out to my co-pilot here on the couch, Tyler. We love having you. This is fun to do. We'll sign off with that for another episode of the Many Minds podcast, using many minds for better patient outcomes. I'm Alex Davis.
I'm Tyler Murray.
We'll see you next time.
Peace.